The Minister of Health and Social Welfare, Professor Ali Pate, has tasked radiologists to identify challenges impeding data security to address increased cases of litigations from patients against its members. The minister made the call on Monday in Abuja at the 6th Annual General Meeting Scientific Conference of the Association of Radiologists in Nigeria and the 60th Annual General Meeting of the Association of Radiologists in West Africa. Pate noted other challenges like manpower deficit, poorly regulated radiology practice in the country, and inadequate technology innovation. Now, the minister, however, said that the government is working to produce middlemen to bridge the gap of manpower deficit, adding that this must be done in order not to snowball into the promotion of substandard service. And to further discuss this, I am joined by Bayode Thomas. He's the country director, InstantRad Nigeria, head of radiography, Marigold Hospital and Critical Care Center. Good afternoon, Bayode, and thank you so much for joining me on the news.
Hi, good afternoon. Thank you so much. Super excited to be here.
It's a good thing you're here. We're happy to have you.
Thank you.
All right, so as a radiographer, Bayode, how do you currently ensure data security in your practice, and what challenges do you face in this regard?
All right, yeah. So we have, as radiographers, we have a job to ensure that medical images of patients are, are acquired, they are stored, and they are easily transmittable to the radiologist for adequate reporting, right? And we do that in different ways, right? But now, with emerging technology, we've been able to be able to save patients' data. Before now, you can be very surprised that someone's image is on someone's WhatsApp or probably email, because that's how it's usually transmitted. But now, with a robust PAC system and a robust RIS system, the images can be acquired from the machine and can be transmitted via standardized platforms, technology platforms that encodes the imaging data in its real format, and is also accessible by the radiologist and also by the patient if they need access to it.
All right, so now the minister mentioned during the AGM that manpower deficit is one of the challenges in radiology practice. Now, how do you think this deficit affects the quality of patient care and the overall healthcare system?
To be very honest, the deficit is super alarming, especially for radiologists. I currently work with InstantRad as country lead, and just a teleradiology company. We connect hospitals to radiologists, so I work with radiologists on a day-to-day basis. And it will amaze you that we have less than 300 radiologists serving over 200 million people. And let me even be fair with that figure. Let's say we have less than 500. That's to be very, robust with the figure, so that I'm not exaggerating the numbers. And in Nigeria, we generate about 500,000 medical images every day. Now, this means that patients literally walk into, facilities, radiology facilities, to do their X-rays, the CT scans, their MRIs, ultrasounds, and all sort of imaging modalities. Right, and they walk into different hospitals to pay, and we have over 500,000 of those images generated every day, right? And we have just less than 500 radiologists reporting each of these images. Obviously, you can already tell, some of the challenges we're going to face. Number one is fatigue. The radiologists, because the images cannot just be transmitted anyhow via WhatsApp or any other means, it has to be transmitted in its DICOM format. File extensions for medical images are called DICOM. Right, and when it's transmitted in its DICOM format, and in that way, the radiologist will actually either have to be physically present in those facilities, or they have standardized methods in which the images can be transmitted to them. And they can tell you that first they'll be fatigued because they have to go from different centers, or the images have to come to them from where they are.
Bayode, I remember you saying something about, patients getting their results via WhatsApp. And, it does seem like from all that you have said that technology innovation is not really, the problem when it comes to, radiography, because it was actually highlighted as one of a challenge, at the AGM. So how do you see advancements in technology playing a role in improving radiology practice and patient outcomes in Nigeria?
So the truth is that because of the reduced number of professionals that we have, technology plays a mighty role in this. First, there's brain drain already. There's the Japa move sensation already in existence, which means that radiologists, the reduced numbers that we have are already even living again. And that's why, with the platform that we created, that's the InstantRad platform, it's a technology platform as well that helps the radiologists, even though they're not physically present in the center, have access to the images in real time and encoded, HIPAA compliant, NDPR compliant. So these are data privacy, organizations, both globally and nationally, to ensure that the patient's data privacy is intact, and as well, the images are still in its format and it can be easily accessible by the radiologists. With this, the radiologists don't have to be physically present in the hospitals anymore. They can now, from the comfort of their houses, make reports on images and send the reports to the patients. And reports that will probably take 3 days, 7 days, sometimes 30 days is now reduced to 20 minutes, 30 minutes, and you're sure that, so another key thing again is that before, one radiologist is reporting multiple images, but with technology now, multiple radiologists can be reporting for just one single center, even though they are all reporting for multiple centers, but it is no longer one person. So if one person is tired, another person can pick up the images and make a report on it.
All right, you would agree that, a practice like radiology that has to do with the lives of people needs to be regulated. The minister also emphasized the need for a well-regulated radiology practice, right?
Yeah.
But what are your thoughts on the current state of regulation in this field, and what measures do you believe should be taken to address any shortcomings?
So, working with radiology professionals, across the world, you see that one of the challenges that we face is that we are not streamlined on the way we offer our services to patients first. Like for instance, we have Nigerian radiologists who are residing in Nigeria, and Nigerian radiologists who are probably residing outside of the country. More priority should be placed on Nigerian trained radiologists reporting Nigerian cases. And we've seen several cases where, we bring in, other part of the world, in Asia, Europe, other people, report our cases, and, they are not exposed to our realities, really, our patients' realities. And this can also, pose a situation where we're not accurately making reports on patients' images. Also, that we should have subspecialty radiologists as well report subspecialty cases. Right, so these are part of regulations that I think that should be put in place as well.
All right, briefly, just before we go, how do you balance, how can this particular sector find a balance between, regulation and also substandard practice?
First is that we should all think value for human life. If that is our focus, then everything we're going to be doing will be centered around ensuring that the patient gets the best of care. While we're trying to balance regulation, we should also think of how to make the patient's images, easily accessible. The truth is that radiology is pretty much is largely on diagnosis. While we have therapeutic cases with radiotherapy and the likes, right? But it's largely on diagnosis, which means it's the first point of contact for every patient. So every patient will have to go through diagnosis first. And the diagnosis determines the quality of the treatment or the quality of the patient's life in the hospital eventually, right? So that is why we must think of the patient's care first, and while we are also trying to impute the regulations to ensure that we are offering our services at the best and optimum way better, and also ensuring that the quality of life is also kept at high standards.
All right, well, thank you so much, Bayode Oke Thomas, for joining me on News Central to discuss this.
Thank you.